Welcome to our presentation on statin-associated muscle symptoms. This video by Dr. Adedeloye is for educational purposes only. Next, a brief overview. Statins are a class of medications widely prescribed to lower cholesterol levels and reduce the risk of heart attacks and strokes. They block a liver enzyme that produces cholesterol, lowering your risk of heart attacks and strokes. But watch out! Some people experience muscle pain or weakness, known as statin-associated myopathy. If you feel unexplained muscle cramps, especially in your thighs or shoulders, take note. This video will help you recognize these symptoms early and what to do next. Talk to your doctor about staying heart-healthy and symptom-free. Statins are categorized by their intensity in lowering LDL cholesterol. High-intensity statins like rosuvastatin and atorvastatin lower LDL by over 50%. Moderate-intensity options reduce LDL by 30 to 49%, while low-intensity statins lower it by less than 30%. So what is SAMS? Statin-Associated Muscle Symptoms, or SAMS, refer to a spectrum of muscle-related adverse effects caused by statin therapy. Symptoms range from mild discomfort to severe conditions like rhabdomyolysis. Lipophilic statins, such as simvastatin, are more commonly associated with these symptoms. The spectrum of statin-associated muscle symptoms includes myalgia, which is muscle pain without creatine kinase, or CK elevation, elevated CK without symptoms; myositis, characterized by muscle symptoms with elevated CK; rhabdomyolysis, which is severe muscle breakdown with very high CK and risk of kidney injury; and immune-mediated necrotizing myopathy, which is an autoimmune muscle damage with progressive weakness and persistent CK elevation despite stopping statin. Balancing the benefits and risks of statin therapy is important. While statins effectively lower cholesterol, they can pose risks like muscle symptoms. So, which patient population is more at risk? Certain individuals are more prone to statin-associated muscle symptoms, or SAMS. Advanced age, female sex, and low body mass index can increase this risk. Genetic factors play a role too, making some more susceptible. Coexisting conditions like diabetes, hypothyroidism, hypertension, kidney and liver disease elevate the risk even further. High doses of statins, especially lipophilic ones like simvastatin and atorvastatin, can contribute significantly. Using other medications, especially those that interact with CYP3A4 enzymes, adds to the concern. Even lifestyle choices like intense workouts or heavy drinking can worsen muscle-related side effects. Certain drugs can increase the risk of statin myopathy due to drug-drug interaction. These include amiodarone, macrolide antibiotics, azole antifungals, verapamil, fibrates, especially gemfibrozil, and grapefruit juice. They often inhibit CYP3A4 or interfere with statin metabolism and clearance, leading to increased statin levels and potential toxicity. Symptoms of statin myopathy often include symmetrical pain in the thighs, shoulders, and upper arms. Dark urine may indicate severe muscle injury. The next video explores these symptoms in more detail. Patients taking statins, listen up. You might experience muscle-related symptoms that could indicate statin-associated myopathy. These can range from mild aches and cramps to fatigue, especially in your thighs and shoulders. Feeling weak during everyday activities? That could be a sign. In severe cases, you might develop myositis or even a rare condition called immune-mediated necrotizing myopathy, causing progressive and profound weakness that does not improve even after stopping the statin. Rhabdomyolysis is the most serious, causing intense pain and dark urine from muscle breakdown products like myoglobin, and the potential for kidney damage. If you notice any unusual muscle symptoms, report them to your healthcare provider immediately. They may need to check your creatine kinase levels. Clinicians should suspect statin myopathy when new muscle symptoms arise after starting or increasing statin doses. Elevated creatine kinase levels and unexplained worsening symptoms are indicators. Drug interactions should also be considered. Managing SAMS involves assessing symptom severity and checking CK levels. Other causes like thyroid disease should be ruled out. If symptoms are moderate to severe, discontinuing the statin. Switching to a hydrophilic statin may be necessary in some patients. This table looks at the spectrum of statin-associated muscle symptoms and their management. Myalgia, the most common form, presents as bilateral symmetrical muscle aches, soreness, or stiffness, often in the thighs, shoulders, or upper arms, without significant elevation in creatine kinase or CK. Management typically involves reassurance, lifestyle review, and considering a temporary statin pause or switch to a hydrophilic statin like pravastatin or rosuvastatin at a lower dose. Asymptomatic CK elevation is characterized by elevated CK without muscle symptoms and usually does not require discontinuation unless CK rises above 10 times the upper limit of normal. Myositis, or symptomatic myopathy with elevated CK, typically above 3 to 10 times upper limit of normal, warrants statin discontinuation, thorough evaluation for other causes like hypothyroidism, drug interactions, and re-challenge only after resolution. Rhabdomyolysis, a life-threatening condition, involves marked CK elevation, often above 10,000 unit per liter, myoglobinuria, and risk of acute kidney injury. It requires immediate statin cessation, aggressive IV hydration, and hospitalization. The rarest form, immune-mediated necrotizing myopathy, IMNM, is an autoimmune process characterized by progressive weakness, very high CK, and persistent symptoms despite statin discontinuation. It is confirmed by anti-HMGCR antibodies and muscle biopsy and requires long-term immunosuppressive therapy. It is important to note that there are alternative lipid-lowering options available for those completely intolerant to statins. These include ezetimibe, bile acid resins, fibrates, and PCSK9 inhibitors like evolocumab or Repatha. They offer effective cholesterol management without the significant muscle-related side effects of statins. Patients should be aware that muscle symptoms are common with statins but often mild. Severe muscle injury is rare but requires immediate attention. It's important not to stop statins without consulting a healthcare provider. Key takeaways include understanding the balance between the benefits and risks of statins. Statins remain one of the most effective medications for reducing cardiovascular risk and preventing heart attacks and strokes. Sure, statin-associated myopathy can happen, but it's usually mild and manageable. Both patients and doctors need to watch for any new muscle aches or weakness. If you notice something, check those creatine kinase levels right away. Catching issues early can prevent serious complications down the line. And remember, muscle symptoms don't mean you have to stop statins forever. There are effective alternatives and modified statin regimens to help maintain cholesterol control and protect long-term cardiovascular health. Thank you for engaging with our content on statin-associated muscle symptoms. If you found this information valuable, please like and subscribe for more educational content. Your support helps us continue providing quality information.